ये ऐसे म्यूट ऑप्शन। एक टीम
ஒரு பிள்ளைங்க ஒரு ஸ்டேஜ் வரணும்.
Yeah, right. Okay, ma'am. We will be. Okay. Introduce. Oh, okay, ma'am. We are ready. Okay, thank you. Just to get some.
A very warm good evening to one and all present here. I can see that many parents have joined. Our chief guest and the guest speaker for today, Dr. Ahmed Rafi, has also joined. So we will begin the session shortly. So please bear with us.
Hello.
A very warm good evening to one and all present here. We are here today with a session for the parent community of our school on the topic diabetes and its management. Diabetes is a disease which all of us are familiar with. Most of us have heard of it, know of someone suffering from diabetes, or even suffer from diabetes ourselves. November is the Diabetes Awareness Month, a time to focus on a disease that affects a large percentage of population across the globe. For people with diabetes, the awareness levels may be unique to their journey with diabetes. I request all of you to please mute your microphone. From novice to advanced. Since diabetes is a chronic condition, a direct impact on human health, there is a crucial need to raise awareness about the relevance of diabetes, to educate people who may not understand the symptoms, risk factors, and treatment options. Keeping this in mind, Emirates Future International Academy is conducting a webinar on the topic Diabetes and its Management to educate and raise awareness among the parent community of our school. We have with us today Dr. Ahmed Hussain Rafi Ahmed to enlighten us on the subject. On behalf of the school, it's my sincere pleasure to welcome our guest speaker for the day, Dr. Ahmed Hussain Rafi Ahmed, to the event. A very warm welcome to you, sir. Let me also take this opportunity to welcome our dearest principal, Mr. Saji Amin, and our most beloved vice principal, Ms. Raufia, to join us today. And it's my pleasure to extend a cheerful welcome to my colleagues with all my heart. Finally, and above all, on behalf of Emirates Future International Academy, there is a hearty welcome, big and warm enough to encompass all our dear students and parents to this session. Once again, I welcome you all. To start the session, let me first call upon our principal, Mr. Saji Amin, to speak a few words to us.
Good evening. Good evening, Dr. Rafi, dear Vice Principal Rafi Amma, and our respected parents, and our respected teachers. This is another milestone in our school, mainly to address our parents, because nowadays we know it does normally. Parents are very much worried due to this pandemic. What exactly, a lot of things they are not able to communicate with, especially with the doctors or anyone. And they are not aware about a lot of things. So that is the reason we thought with our parents' council to think about how to help the parents in such situations. So that is the reason why we come to this conclusion of requesting some specialist to address our parents and clear their doubts. So in this time, Mr. Satyan from Mahalli Hospital, as we have a regular contact with him, and as part of it, he agreed to give us a good consultant, Dr. Muhammad Rafi, and as everyone knows, he is a very specialist in this field, especially in diabetes, where he can easily guide us in so many areas where the parents can get their doubts cleared. Now, in this evening, we are expecting more parents to join in between. And what are the doubts you are having, you are able to clear with the doctor. And on behalf of the management, let me also welcome Dr. Ahmed Rafi to this our function in this program in a virtual platform. And this virtual platform helped us a lot to convey a lot of things to our parents. So once again, I thank Ahilya Hospital for providing this opportunity by providing us with a doctor to give a clear picture about what is diabetes and how it can be managed to our parents who are really required this one. So I wish all the best, and I welcome the parents and all the teachers and all our guests on this special occasions. Thank you once again. And now I don't want to take much time because very important is the doctor's information today. So I will give the platform to the. Thank you very much.
Thank you very much, sir. Our guest speaker for today, Dr. Ahmed Rafi, is a specialist in internal medicine who works with Ahalya Hospital. He has more than 28 years of experience in medical management of all kinds of internal medicine and patients. He has worked as an assistant professor in a postgraduate medical college and has served as a registrar in cardiology in Christian Medical College Hospital, Vellore. He was also a part of the internal medicine wing at Align Government Hospital. With his talent and expertise, I cannot think of a person more suitable to enlighten us today on diabetes and its management. I'm sure all of us are going to get to learn a lot from this session. Without further ado, on behalf of everyone at Emirates Future International Academy, let me welcome our speaker for today, Dr. Ahmed Rafi, to speak to us.
Good evening, respected Vice Principal, and all the teachers, parents, and everyone in the Emirates School. And thank you so much for your kind words. And today I will just shed few light on diabetes as well as other lifestyle diseases. You all know diabetes is one of the very important lifestyle disease. So I will shed few light about diabetes mellitus, number 1, and number 2, blood pressure, that is called hypertension. Number 3, high cholesterol, or otherwise called dyslipidemia or hyperlipidemia. Because commonly nowadays everybody suffers or having any one of these 3 problems. So I thought it will be better to just say a few words about all these 3 common lifestyle disorders. So first let us see about diabetes mellitus. As everybody knows, the word diabetes mellitus is a Greek word. Diabetes means siphon, that is to pass through, and mellitus means sugar or honey. So diabetes mellitus is an ancient Greek word. There are 3 types of diabetes.
I can see the
Sorry for the disturbance. Are the audience are able to visualize the slides?
It was visible at first, doctor, but then later it went off.
Our technical IT support team is working on to make it visible for the audience also.
Okay, doctor. I request all the parents to turn off your camera so that there is no interruption between the presentation.
Yes, sir. Now it's visible.
Diabetes mellitus is divided into broadly 3 categories: type 1 diabetes mellitus, type 2 diabetes mellitus, gestational diabetes mellitus. So what is diabetes mellitus? Type 1 diabetes is a disorder that normally interrupts the way your body uses your sugar, that is glucose. All the cells in our body needs glucose or sugar for normal day-to-day performance of daily activities. So glucose gets into cells with the help of a hormone called insulin. If there is no adequate insulin, or if the body stops responding to insulin, then the blood sugar or glucose increases in the blood, which happens to people with a disorder called diabetes mellitus. So, as I told you earlier, there are two types of diabetes, type 1 diabetes and type 2 diabetes. People with type 1 diabetes make little or no insulin production. So, people with type 2 diabetes sometimes also make too little insulin, but more often the problem is that their cells do not respond to the insulin activity. If anybody has got any doubts, like at the end of the session, you are most welcome to ask all your questions. I am available to respond to all your questions. So first, let me shed a few light about diabetes, hypertension, and dyslipidemia or high cholesterol levels. So what is the cause of diabetes mellitus? Diabetes mellitus is mainly due to a disorder of pancreas, and particularly there are certain cells called islets of Langerhans in the pancreas. These cells are very important to secrete the important hormone called insulin. If there is defect in production of insulin, or if there is defect in the activity of insulin over the cells, then the disorder called diabetes mellitus results. So what are all the important risk factors for type 2 diabetes? Type 1 diabetes, I will talk later, because type 2 diabetes is the most common disorder which most of us are suffering. So what are all the most important risk factors for type 2 diabetes? First of all, there may be a family history of diabetes, that is genetic factor. For example, if there is a first degree relative like father, mother, grandparents, if they are affected, it is most likely their generation may also get affected. So that is called, strong family history. And if the body mass index or if the weight is more than 23 kg per meter squared, then again there is a high risk that individual may develop diabetes mellitus. If anybody who leads an inactive lifestyle, particularly a very sedentary lifestyle, then he is more likely to get diabetes mellitus. Any person who has got high blood pressure or high cholesterol levels, then again they are at more risk for developing diabetes mellitus. Females, particularly in the reproductive age group, particularly when they are pregnant, then they may develop a diabetes called gestational diabetes, which I will brief later. And any person who is more than 40 years, again, they are more likely to get diabetes mellitus. So if any person who is having impaired glucose tolerance or impaired fasting glucose, these are all certain medical terms, don't bother about that. If you have any questions at the end, I will respond to them. So what are all the important symptoms of diabetes mellitus? Or how do you know that whether you have diabetes or you don't have diabetes? First, if any person feels always very thirsty, then there is a possibility he may have diabetes mellitus. Number two, suddenly the vision is blurred out, or if suddenly there is defect in the vision, then he has to consult the doctor to check his sugar levels. If any wounds occurs and if it takes longer time to healing, then again there is a possibility that sugar levels may be high. So if any person, either male or female, they frequently become very tired without any reason, then again they have to check their blood sugars. Married persons, particularly male and female, if they have sexual problems, particularly men erectile dysfunction and females lack of interest and genital infections, they have to consult the doctor to check their blood sugars. And if any person, particularly male or female, if they have numbness, tingling in hands and feet, or crawling sensation like insect crawling sensation, then again they have to check their blood sugar levels. Any person frequently visits toilet to pass urine, again they have to consult their doctor to check their blood sugar and urine sugar levels. Women, particularly whether they are in the reproductive age group or older women, if frequently they get genital infections, again they have to check their blood and urine sugar levels. Any person who is always feeling hungry, again they have to check their blood sugar levels. Sudden onset of weight loss without any known reason, then again diabetes is a possibility, so they have to consult the doctor. So how do I know whether I have diabetes or not? This is the common question every person has. Very simple. Just visit your doctor. So only just 5-minute blood test and urine test. With that, the doctor may be able to tell you whether you have diabetes mellitus or you don't have diabetes mellitus. So what are all the criteria for diagnosis of diabetes mellitus? As I told you earlier, the classical symptoms of diabetes are increased thirst, that is polydipsia in medical terms, and increased hungerness, that is called polyphagia, and increased urine production or increased frequency of urine, that is called polyuria. So anybody has got polyphagia, polydipsia, polyuria plus weight loss, they have to check their blood sugar level. If random blood sugar levels are more than 200 milligram per deciliter, random means irrespective of the food intake. At any point of time in 24 hours, if they check their blood sugar, if it is more than 200 milligram per deciliter, that indicates with these classical symptoms of polyuria, polydipsia, and polyphagia with weight loss, that indicate that person has got diabetes mellitus. Or if the person is fasting overnight, more than 8 hours, after the last intake of meal at dinner and morning, he is checking his sugar after brushing his teeth, if it is more than 136 milligram per deciliter or more than 7 millimoles, that indicates he has got diabetes mellitus. If a doctor is doing an oral glucose tolerance test, particularly for a pregnant woman, this OGT normally we do for a pregnant woman, and people, those who have symptoms but the blood sugars are always in the normal range, for these people, the doctors use a test called oral glucose tolerance test to diagnose whether that person is at risk of developing diabetes. If this test shows the 2-hour plasma glucose more than 200 milligram per deciliter or more than 11.1 millimole, again, they are known to have diabetes mellitus. So each of these tests should be confirmed at least twice by the doctor or by any laboratory to label a person as diabetes mellitus. So what is the broad treatment of type 1 and type 2 diabetes mellitus? So as I told you earlier, in type 1 diabetes mellitus, there is either total lack of insulin production or minimal insulin production. In this type of individuals, usually the management is frequent monitoring of blood glucose levels by themselves and regular physical activity as well as a good diabetic diet regimen, and finally insulin use. In type 1 diabetes mellitus, usually tablets, that is oral tablets, will not help because the insulin production is very less in their body. We have to give the hormone insulin externally in the form of injection. So this is broadly the management of type 1 diabetes mellitus. So commonly we see type 1 diabetes, very less percentage of people in the population. That is, they constitute only 20 to 30% of population, whereas 70% of population are coming under type 2 diabetes mellitus. This is due to a metabolic disorder, most likely due to lack of exercise as well as irregular food habits, sedentary lifestyle, and other genetic factors. So what is the broad management? As I told you earlier, frequent monitoring of blood sugars at regular intervals and regular physical activity, eating a healthy dietary regimen for diabetes mellitus, and treatment with oral medications. After a certain period of time, the oral medications may not work. In those people, we need to supplement them with additionally insulin, or sometimes we will completely avoid tablets and we will put them on insulin. This is the management of type 2 diabetes mellitus. So how often a diabetic patient need to see the doctor? At least yearly they have to see. Every 3 months, better to see if their blood sugars are well under control. If their sugars are not under control, then the doctor may ask them to visit little frequently to optimize their blood sugar as well as their medications to prevent complications of diabetes. Also, every time when you visit the doctor may measure your cholesterol, blood pressure also, to assess whether you have any other additional risk factors like high blood pressure or high cholesterol levels. And during your clinic visits, the doctor may do a special test called glycosylated hemoglobin or HbA1c levels, which tells your average last 3 months sugar levels. Because just before coming to the doctor, the person may just fast nicely and he will come with a very low blood sugar. But if the doctor checks this HbA1c level, he may have an idea about your last 3 months average sugar. Based upon this test, the doctor will optimize the medications for you. So many patients, they may ask the doctor, doctor, my fasting sugar is now completely normal. Why do you want to start my medication? So this decision is made upon this important test called HbA1c or glycosylated hemoglobin. Yeah. So what is the target levels for this HbA1c or glycosylated hemoglobin, which reflects your last 3 months average blood glucose levels? So if a person who is only on lifestyle modification and only on diabetic diet, who is not taking any medication, for them, the normal HbA1c level should be less than 6. It is quoted here as 6.5%, but ideally, optimally, it should be less than 6. And again, people, those who are on diabetic diet, lifestyle modification measures, in addition, oral medications, like commonly people used to take metformin for the control of diabetes. So for them, the sugar levels, the HbA1c level should be 6 to 6.5%. And optimal, again, it should be less than 6%. For people, those who are already taking medication, as well as those who are on lifestyle modification and diet control, for them who are frequently like encountering hypoglycemia, that is low blood sugar levels, frequently having low sugar level symptoms like sweating, dizziness, and headache, nightmares, for all these people, the American Heart Association and Diabetic Association, they have kept a target level of 7%. For them, it is a little less. 6 to 7% can be the target level for them. So, when is self-monitoring of glucose is required? Particularly when a woman is pregnant, they have to frequently monitor the sugar levels. When a diabetic patient frequently encounters hypoglycemic episodes, again, frequent monitoring of blood sugars are required. Any person who is on oral medication, who is at increased risk of hypoglycemia, that is low sugar levels while driving or operating heavy machinery, then again they need to check their blood sugar level to prevent them from going into hypoglycemia. So always self-monitoring of glucose is very, very important. Even though your sugars are well under control, at least weekly twice or thrice you need to check your fasting sugars as well as 2 hours postprandial sugars. That is 2 hours after taking the meals, you need to check your blood sugars. So what are all the important complications of diabetes mellitus? So diabetes mellitus is one of the deadly diseases which can produce permanent disabilities if not properly controlled. So number one, it can produce cerebrovascular disease, or in simple terms, it can cause stroke. By occluding a blood vessel in your brain, it can produce permanent disability by a disorder called stroke, brain stroke. Number two, sudden loss of vision may happen if blood sugars are not properly controlled. Initially, the person may have dimness of vision. If it is not properly checked and treated, he may lose his vision permanently. Number three, a person with diabetes, if uncontrolled, there may occlusion of heart blood vessel may happen. That is called, in simple terms, heart attack. And if the sugars are not well under control, again, the blood supply and nervous system in the lower limbs, so lower extremities may get affected, and it may produce a disorder called diabetic neuropathy. And next complication is any person whose sugar levels are not under control, they are prone to develop foot infection as well as diabetic foot ulcers. So last but not the least, diabetes can affect the kidney and permanently damage the kidney, leading to kidney failure and permanent dialysis. So these are all the most important complications of the diabetes if diabetes is not kept well under control with diet, medications, as well as lifestyle modification. So what is neuropathic pain? Every diabetic patient, at some point of their life, they may experience either shooting pain in their lower limbs or stabbing pain, electric shock-like pain, burning sensation, tingling, numbness, or sensation of pins and needles. This is called diabetic neuropathic pain. So during every visit to your doctor, if you experience any of the symptoms, kindly inform your doctor so that he can do a special test called nerve conduction study. By doing this study, we can identify if there is any problem in your nervous system in the limbs. At an early stage, you can prevent it so that it will not lead to later complications. There are plenty of tests available. Your doctor may choose based upon this special test called nerve conduction study of the lower limbs. So what are all the important risk factors for diabetic foot? Diabetic foot is like always, every diabetic patient, before going to sleep, they should always inspect their lower limbs, particularly their feet, to look for broken skin, presence of any ulcers, blisters, areas of increased warmth or redness or change in color of the skin. If there is, they have to take care of their foot as if they are taking care of their face. For every diabetic patient, they don't care of their foot, ultimately they may lose their foot or limb. So to prevent this complication, everyday self-examination is very, very important. Even if a small ulcer is present, you should immediately bring it to the notice of your doctor and get it treated properly, as well as you have to get your sugars well under control. So in the people with type 1 diabetes, after the onset of type 1 diabetes, at least once in every 5 years, the feet examination should be done by the sub-doctor. And people with type 2 diabetes, from the time of onset of diabetes or from the time of diagnosis, during every visit, the patient should notify any symptoms or signs, as I told you earlier. If it is present, they have to inform the doctor so that they may conduct some special test to prevent the complications. So how to prevent this diabetic complication? What are all the measures to prevent all this complication? First and foremost important is regular health checkup. At least once in 3 months or at least once in 6 months, you need to visit your doctor or you need to do a blood sugar and urine sugar. Very simple. And you have to check your cholesterol levels as well as you have to check your blood pressure levels. Then monitoring and stabilizing and managing the weight. Reduce salt consumption as well as reducing stress factors, keep ourselves relaxed. Increasing the activity level by doing aerobic exercise and to managing the blood pressure level. If any blood pressure levels are increased, we have to immediately visit the clinic and properly get it investigated. And according to the doctor's advice, if blood pressure is managed properly, they may not have result in additional complications like cholesterol and diabetes mellitus. And try to eat a healthy diet whenever possible. And also always try to limit your sugar intake. These are all certain important measures which can prevent diabetes and also its complications. So what are all the foods a diabetic patient can take? It's a very big list is there, but just things to be avoided, mostly fried food, fast foods, and particularly sugary sodas like colas, bread and bakery products, sweets, cakes, ice cream, processed meats, pasta like high carbohydrate diets, burgers and french fries. These are all the important foods that need to be avoided by a diabetic patient. So they have to always consult the doctor and the doctor may refer you to the dietitian. The dietitian will properly chart a plan for you according to your diet and lifestyle, according to your works, your nature of work also. This will help you to control your diabetes well in addition to the medication. Here are a few words about hypoglycemia. Earlier I mentioned the terminology called hypoglycemia. Hypo means low, glycemia is sugar. So when there is low sugar, a diabetic person should be aware of these signs and symptoms. And also the family members also should know what is low sugar, what are all the symptoms of low blood sugar. So what do you mean by hypoglycemia? Hypoglycemia is the state of low blood sugar and it is caused by either too much insulin or too little sugar in the body. It is defined as a blood sugar level below 70 milligram deciliter or 3.9 millimoles. What are all the signs and symptoms usually the patient will experience? Number one, suddenly the patient will become anxious and they may have either blurred vision or they may have difficulty in speaking. Suddenly they may say their heartbeat is very fast or pounding heart. They may feel very suddenly cold and sweaty. They may say I have like increased appetite or increased hungerness. And they may feel trembling or sweating a lot. Suddenly they may appear confused. or they may feel that they are nauseated, or they may feel like tendency to vomit. Suddenly the peripheries of the body, like particularly hands and feet, may become suddenly cool, pale, and suddenly the person while sleeping, suddenly get up from the sleep, in the middle of the sleep, with nightmares. If all this, any of these symptoms are present, we need to immediately check the blood sugars, particularly if the person is taking insulin or medication. Because if not properly checked, if a blood sugar less than 70 milligram per deciliter can drastically go lower than these levels and can put that person permanently in coma. Unless treated, it can be fatal. That is, it may lead to even death also. So medical intervention is very, very important. So what the family members can help these patients immediately? Sorry. If the person is conscious and sugar is less than 70 milligram per deciliter, either you can give glucose tablets, which is commonly available in every pharmacy, or you can give glucose gel, or you can give a spoon of sugar, teaspoon of sugar, or you can give 1 cup of fruit juice, or if nothing is available, only if some fruits are available, you can give fruits also. Suppose if the person is unconscious, immediately you have to call the emergency service by calling 999 and get the medical emergency help and take him to the nearest hospital for emergency management. So now let us see a few words about hypertension. Hypertension is high blood pressure. What do you mean by blood pressure? Blood pressure is the force of your blood moving against the walls of your arteries. It is expressed as two numbers. Normally the doctors used to say 120, 80. This is, the upper number is called systolic blood pressure and the lower number is called diastolic blood pressure. So what is systolic blood pressure? The pressure of force in the arteries when the heart is contracting is called systolic blood pressure. And the blood pressure which is measured when the heart is relaxed is called diastolic blood pressure. Normally, which is measured in two numbers. So normal blood pressure is 120 by 80 millimeters of mercury. 120 is systolic blood pressure, 80 is diastolic blood pressure. This is the optimal blood pressure. Anything which is above 120 by 80 is called an elevated blood pressure. Up to 125 by 85, it is acceptable blood pressure. And up to 135 by 85, again, it is acceptable. Anything which is beyond 140 by 90, the person has to consult the doctor and take their suggestions and investigations accordingly. So what are all the important risk factors for blood pressure, developing a blood pressure? Males are more commonly prone to develop high blood pressure or hypertension and compared to females. When a person is obese or weight is high, then again he is more likely to develop blood pressure. When there is decreased activities, again he is more likely to develop high blood pressure. Age. Any person who is more than 40, he is more likely to develop high blood pressure. Genetic factors. If any person who has first degree relatives, again having blood pressure like father, mother, brother, sister, grandparents, again they are more likely to develop blood pressure at an younger age group. And lifestyle like stress, increased anxiety, all this mean elevate blood pressure. Increased sodium intake, that is common salt. The table salt, if anybody increases more than 1.5 grams per day, they are more likely to develop high blood pressure. Again, consumption of alcohol, smoking, increased caffeine, that is coffee intake, all these things will chronically lead to high blood pressure for us. Any adult who is more than 30 to 40 years are advised to check their blood pressure at least once in 6 months. As I told you earlier, the optimal or normal blood pressure is 120 by 80 millimeters of mercury. Any blood pressure which is more than 140 by 90 is high blood pressure. So if anybody is encountering this kind of high blood pressure like more than 140 by 90, it's better to visit the clinic, check their blood pressure once again, And whatever the doctor advises, the investigation, better to undergo and follow the advice given by the doctor. So without medication, how to reduce your blood pressure particularly? So one is, first and foremost, is weight management. If anybody who is able to manage their weight properly for their height and age group, they can reduce the blood pressure without medication. A good proper diet which is rich in fruits, vegetables, low in fat, they are also able to bring down their blood pressure properly without medication. And restricted sodium intake, as I told you, less table salt intake, that is less than 1.5 grams per day, will also maintain your blood pressure without medication. And increase physical activity. If any person who is physically more active, or at least 90 to 150 minutes of physical activity per week is enough to maintain their blood pressure. And reducing the alcohol consumption or abstaining from alcohol will also help you a lot in bringing down your blood pressure without any medication. So there are a lot of medication available for reducing the blood pressure. Your doctor will decide based upon your investigation, your age, height, and weight. Again, what are all the important complications of the blood pressure or hypertension? First and foremost, like diabetes, high blood pressure can occlude any one of your brain blood vessels, which may result in a very deadly disorder called stroke, and it may produce permanent disability. Number two, high blood pressure can again it can occlude the vessels, blood vessels in the heart, and it can produce heart attack. So high blood pressure can also produce damages of the kidney and result in permanent kidney failure. And last but not the least, it can affect the vision, and permanently the person can lose the vision. So it is very important, if the blood pressure is like initially on the higher side, to visit the doctor and to get his proper advice, investigation, and to manage it properly with lifestyle modification as well as medications. So now a few words about high cholesterol levels. So nowadays everybody is having high cholesterol levels. What do you mean by high cholesterol? When you have too much fat in your blood, it is called high cholesterol. We have different kinds of cholesterol in the blood. So there are almost 4 parts of cholesterol. One is total cholesterol. Number 2 is low density lipoprotein, that is LDL cholesterol. Number 3 is triglycerides. Number 4 is HDL or high density lipoproteins. So what is the main reason for this high cholesterol levels? Eating food which is rich in fat and not at all exercising, being overweight, smoking, drinking alcohol, and sedentary lifestyle. These are all the common causes for the high cholesterol. Also, this high cholesterol level runs in families. If anybody has got a genetic background, without any of these factors, they can still get high cholesterol levels. So how to lower your cholesterol? By eating a very healthy lifestyle and getting into more exercise. Without medicines, you will be able to some extent, till some age, you will be able to control your cholesterol levels. A diabetic patient and hypertensive patient should be very careful. Particularly these patients are more prone to get high cholesterol levels if they don't exercise properly or if they don't control their diet and control their sugars and cholesterol levels and blood pressure levels. So how do you know whether you have high cholesterol or not? Very simple. Just you need to visit the doctor and do a simple blood test. With that, you can find out whether you have high cholesterol, normal cholesterol, or optimal cholesterol levels. As I told you earlier, the normal HDL cholesterol or good cholesterol, HDL is a good cholesterol level. If good cholesterol level is more than 40, that is very good for your heart, brain. If LDL cholesterol or low density lipoproteins is a bad cholesterol, if it is less than 100, it is very ideal. So the body health will be perfect. It will not lead to any complications. And total cholesterol, if it is less than 200, it will not produce any complications. Anything above these figures may result in complications, particularly brain stroke and heart attack. So cholesterol control is very, very important. So just I have put a few words about diabetes, hypertension, cholesterol. Now the floor is open for the questions. Audience are most welcome for your questions, and I'll be able to all your questions. Thank you so much for spending your time to listen to this webinar.
Thank you very much, Doctor. That was a wonderful and informative session. We are open to questions and answers now. So if you have any questions, please post your queries in the chat box.
Hello, sir.
How can one avoid diabetes or cholesterol?
Please post your queries.
Bye.
Post your queries in the chat box. The doctor will answer all your questions. I would also like to inform you that during this month there is a diabetes screening camp going on at Ahalya Hospital. For more details, if you're interested in attending the diabetes screening camp, you can contact this number and the email ID for more details. I'm attaching the contact number and the email ID here in the chat box. You can contact this number and email ID to get more details about the diabetes screening camp. The first question we have, Doctor, is how can one avoid diabetes and cholesterol through diet?
Excellent question, ma'am. This is a very important question. Most of us want to control our diabetes and high cholesterol level only by diet. Nobody wants to take medication. As I told you earlier, it's very, very important. If you don't have a genetic background, any person can easily avoid diabetes and cholesterol by eating a healthy diet, proper physical exercise, as well as properly, regularly screening your blood cholesterol, diabetes, hypertension levels. And most important is eating a very healthy diet. By these measures, you can avoid diabetes and cholesterol up to certain age. But despite all these measures, if anybody suspects or whatever symptoms I had told, there is a suspicion of any of these lifestyle disorders, particularly diabetes, hypertension, or high cholesterol levels, better to always visit the clinic, check at least once in 6 months to know about your proper laboratory level. Because some people, 10 to 15% of people may not experience any symptoms at all, particularly diabetes, hypertension, and dyslipidemia, that is high cholesterol level. Some 15 to 30% of people may not have any symptoms at all. Only when they go to the clinic, incidentally, they will find out, they will go for some other problem. Incidentally, they will find out to have high sugars, high cholesterol, and high blood pressure. So, always better to have a proper elective checkup once in at least every 6 months.
Thank you, Doctor. Our next question is, are the symptoms for diabetes similar in children?
Excellent question, ma'am. So in children, normally, like adults, children usually most of the children will have type 1 diabetes mellitus. As I told earlier, if there is a strong genetic background, particularly if the forefathers, father, mother, if they have diabetes, children, particularly less than 10 years of age, suddenly they will become like, they will start losing their weight. They will keep on passing, increased frequency of urination will be there, or there will be poor concentration in the schools. Teachers may complain, particularly to the parents, that your child is not at all listening, not very active. And particularly if father and mother has got diabetes, it's always better to take the patient to the pediatrician, check their sugar levels. This is very important. And children also may have poor vision also. They may have like blurring of vision, and there will be vision troubles will be there. Apart from common short sight and long sight, better to check at least the sugar ones, particularly if there is a strong family history of diabetes mellitus. And most of the children, suddenly they will have frequent abdominal pain, and they will keep on vomiting, and also there will be high-grade fevers will be there. This may be the first symptoms of the diabetes mellitus also. The doctor advises to take the insulin, always better to adhere to insulin, and whatever the doctor advises, better to follow up all those things. Children, almost to some extent, we will have like the same symptoms, but it will appear very early in a strong genetic background.
Our next question is, my mother is having frozen shoulders and doctor said it's because of diabetes. Is there any method to reduce the pain other than physiotherapy?
Excellent question, ma'am. Frozen shoulder is a very common complication of diabetes mellitus. any person whose diabetes is, whether it is under control or not under control, after 5 years or even after 2 years, or even after the time of diagnosis, some people may have frozen shoulder. That is, there are some thin membranes around the shoulder. This may get very tightened. This can be relaxed with physiotherapy. If to some extent, if it is not able to relax with physiotherapy, then they have to consult their orthopedic doctor. The orthopedic doctor initially may give some medicines. Even with these medicines, your pain is not under control. There are some other measures which can be relieved by a pain management consultant. In some hospitals, we have pain management consultants. They will advise you according to your level of blood sugar levels, also according to the nature of your job, age. They will advise what to do next. But physiotherapy is the common modality of relieving the pain. Next, simple analgesics, like the orthopedicians will prescribe very simple analgesics. If none of this works, then we have to consult your orthopedician and physician. They will suggest some special maneuvers by which the pain can be reduced.
Our next question is, my niece is having similar symptoms, increased hunger, passing urine often, and has also gained weight. Should she get checked?
Definitely. All these symptoms are like suggestive of maybe there may be a diabetes, may not be a diabetes. So better to take her once to the doctor and check completely. Have a check. So what is her niece age, ma'am?
Miss Tanishka Rahul Magar.
She is 11 years old.
11 years old. Yes, better to just take it to the pediatrician. Less than 13 under pediatrics. Better to check it completely. Yeah.
Okay. Is it irreversible, sir? Because she's very young.
Yeah, diabetes, normally everybody has got the misconception diabetes is whether once we get diabetes, whether we need to take lifelong medication. It's not so. Type 1 diabetes, of course, they have to take lifelong medication. For type 2 diabetes, mostly it is a result of metabolic disorder. This is because of lack of exercise, improper diet, and other lifestyle problems. This can be completely reversible provided the person is eating a healthy diet and regularly exercising, as well as following the advice given by the physician properly. They can completely reverse. Once the HbA1c levels are less than 5.5, they can even stop the medicines. They can control their diabetes only with diet and exercise alone.
Thank you so much, sir.
Yes. So the next question is, I'm doing yoga and exercise regularly and control. My average is 6 to 6.5. Do I need to take medication?
Sorry, ma'am, I'm not getting your question.
I'm doing yoga and this question is from Rajni Prasanna. I'm doing yoga and exercise regularly and controlling. My average is 6 to 6.5. Do I need to take medication?
Yeah. So if your HbA1c or glycosylated hemoglobin level is 6 to 6.5, that shows that your sugars are well under control. Keep continuing your yoga as well as eat your healthy diet. And also if your sugar anytime, if it goes beyond 6.5%, then you have to consult your physician. And most important is maintain your ideal weight. And if you have a strong family background of diabetes, keep checking your HbA1c level at least once in 3 months. Because suddenly it may jump the HbA1c levels.
Yes, the next question. How often do you think a diabetic person can consume sweet or meat if they want to? And what about young individuals who have some kind of condition which might lead to diabetes? How often can a person consume sweet or meat if they want to?
Yeah, this is a very good question. It is a very useful question to everybody, all the viewers. The diabetic person, if their cholesterol levels are very good, they can consume fish is a very white meat and chicken is also a white meat. They can consume as often as they want. But regarding red meat, if the cholesterol levels are optimal or well under control, they can take red meat like mutton as well as beef also, weekly once. But if the total cholesterol, LDL, triglyceride levels are on the higher side, like weekly once they can consume mutton, better to avoid beef. Beef will actually increase the triglyceride as well as LDL levels. And particularly people, those who are above 40 years, it's better to avoid the egg yolk also, that contains a lot of triglycerides. Young age group can take all this, nothing to worry about that. but provided their cholesterol levels are well under control. Regarding sweets, if your HbA1c levels are, as Madam told earlier, if it is well under control, 5.6 to 6.5, like they can have a cheating day once in a month. But provided other days they should have a regular, proper meat plan, and it's better to consult the dietitian according to their diet plan they can take. But monthly ones they can have a cheating day where they can eat their food. Other days they have to control. And keep your sugars monitoring always. Keep your HbA1c also monitoring once in every 3 months. Anytime if it is escalating the target levels, then you have to consult your doctor, and according to the advice, you have to control your sugars.
The next question is, if the parents are having diabetes after the age of 50, are there chances that their children will also get diabetes? Doctor, you're muted, doctor.
Sorry for the interruption. Yeah. So it is also a very good question. If the parents are diabetic, how often the children may get diabetes? So if the parents, both the parents particularly, or any one of the parents like father, mother, if they are diabetic, like if their sugars are whether controlled or not under control, it's better to always keep an eye on their children. There is high likely chance if both parents are having diabetes, the children may also get diabetes. So if any of the symptoms which I had explained earlier, if it is present, or when you are visiting a pediatrician or some other purpose, you can better check their blood sugars also. So that can be very helpful to detect the diabetes if at all, if early, and accordingly you can follow up the doctor's advice.
The next one is a concern, doctor. My sugar is under control, but I'm not getting sleep at night properly, and I get up 2 to 3 times every night, and my age is 59 years.
Yes, madam, this is a very important question. Every diabetic patient, whether the sugar is under control or not under control, to some extent their sleep will be disturbed, particularly if they're above 40 years of age. So to avoid this, you need to avoid to have sleeping in the morning time, particularly in the daytime. If you avoid sleeping, you will get very good control of you will have a very peaceful sleep at night. But again, if sugars are not under control, frequently you may have to get up to pass urine. Nocturnal passing urine is very common even if your sugars are well under control, particularly after 50 years of age, whether it is men or women. For men, because of the prostate problems, they may have to get up frequently for passing urine. For females, the bladder, the urinary bladder neck will have some mild dysfunction because of the diabetes. For this reason, they may have to frequently get up to pass urine. So this is normal, but if you are too frequently going every 1 hour, if you are going to bathroom, then you have to check your sugars and inform your doctor so that the doctor will optimize your medication according to your symptoms.
The next question, what should be the LDL cholesterol range of a normal person?
Yeah, excellent question. The normal LDL cholesterol, optimal LDL cholesterol is 100 milligram per deciliter. Ideal, it can be up to 130 milligram. But if it is more than that, then better to avoid high fatty diet as well as red meat, and to have proper exercise and to consume more fruits if not diabetic. If diabetic, then they have to visit the dietitian to get the proper diet chart and follow accordingly.
Then the next question, I want to ask, the B12 effect caused diabetes if B12 was very low. I have gone for checkup and done all tests. After the test, they told me that my sugar is on border. I always feel dizziness. I feel giddy. Also, is this all symptom related to B12 or diabetes?
Yeah, this is a very excellent question. In every person with diabetes or without diabetes, B12 is a very important vitamin which constitutes most of the nervous system and brain. If B12 is lacking or B12 is deficient, which is quite common in a diabetic person due to the medication they are taking. Commonly, the metformin is a drug. Initially, every doctor starts for a diabetic patient. This, when taken without doing a proper B12 test, after 2 or 3 years later, it may result in B12 deficiency. Once the B12 deficiency results, it may result in numbness, tingling in the feet, as well as dizziness, and also sometimes the person may feel weak, generalized weakness will be there. So when you are having diabetes, usually during the first screening visit itself, the doctor will check your B12 levels and he will keep on monitoring. And any point of time, if you develop symptoms, you will immediately supplement with B12 vitamins. Normally, we take a tablet called Neurobion that contains plenty of B12. If B12 is still deficient, you have to discuss with your doctor. The doctor will design the treatment according to your B12 levels.
Then the next question is, if a person is a heart patient, like someone who has done angioplasty, what is the cholesterol level to be maintained?
Excellent question. Whether the person is a heart patient or not a heart patient, the cholesterol level is, the above stated level is normal for every person. As I told you earlier, total cholesterol should be less than 200 always, triglyceride should be less than 150 always, and LDL cholesterol should be less than 100, and HDL cholesterol should be more than 40. If heart patient, for them, it is always better to have in this optimal range. Non-heart patient, for them, even if it is borderlinely high, little bit high, their age is low, there is no much risk factors, no need for medication. For heart patients, they have to take medication. In addition, they have to follow a proper diet control, plus physical activity is very, very important. So they have to control their cholesterol levels very well. Otherwise, it may result in, again, second or third coronary events or heart problems, it may result again. So your cholesterol control is very, very important for a heart patient. It is very vital. In addition to the medication, cholesterol control is most important for a heart patient, particularly if they had undergone bypass surgery or angioplasties.
The next question is, does it have any symptoms on skin, like black patch on neck and armpits?
Yeah, excellent question. This black patch indicates that you have insulin resistance. Insulin resistance is there is adequate production of insulin in your body, but only thing it is not acting on the tissues properly. So this on long term will result in the nape of the neck, backside of the neck, underarms, in the axilla, groins, and also in the backside of the buttocks. In these regions, you will get black patchy area. This medical terminology, we name it as acanthosis nigricans. So normally we think that this is due to exposure of sun, but you have to check your diabetes levels. If diabetes levels are high, then you have to control. Until you have to, if you control your diabetes level, this black patches will not disappear. This indicates this is an early warning sign that you are going for insulin resistance. You have to control your weight as well as your diet and check your sugars. Accordingly, take the doctor's advice also. This is not a simple dermatological problem. There is an underlying metabolic problem.
The next question is, what should I take in balanced diet and any exercise for that? Please tell me, doctor. A balanced diet or exercise for the problem of diabetes, I guess.
Now, your balanced diet is actually, your balanced diet means usually it should contain 20 to 30% should be carbohydrate and 40% should be protein, 30% can be fat. And in addition, every day we need to have at least a good portion of fiber containing fruits, particularly whether you are a diabetic also, you can take a portion of fruit salad that contain plenty of fiber that will help to prevent constipation. And also every day, minimum 30 minutes of exercise or at least weekly 150 minutes of exercise is must to keep yourself healthy and to prevent you from all these lifestyle disorders.
Yes, doctor. The next question, if an 18-year-old boy is suddenly diagnosed as diabetic with high order, is the problem reversible when he grows up by taking necessary medications?
This is a very important question. The 8-year-old boy is diagnosed to have diabetes. For lifelong, he will remain as a diabetic. Right now, there are a lot of parts in the world, like particularly UAE, America, and also in Western world, they are replacing the pancreas now. They are doing pancreas transplantation. By doing the pancreas transplantation or by doing the transplantation of islets of Langerhans, where the insulin is being produced, you can completely reverse the diabetes. Or by another method called gene transformation, we can actually completely reverse the disorder. This is still ongoing research area. It is not completely available commercially, but it is available in certain parts of the world, like America, it's still available. In India also it is available. Pancreatic transplantation is available. Stem cell transplant also, there is a lot of research is going on. Maybe in future, near future, the diabetes may be completely reversible with this newer techniques.
Yes, Doctor. Doctor, do we have time for one more question?
Yeah, sure. Why not?
So the last question is, how can one handle a wound if he or she is diabetic?
Yeah, excellent question. As I told earlier, every diabetic person before going to sleep, they have to keep a mirror and to look at the sole of the foot to see if there is any ulcers, blisters, or any cracks. If they find anything, without any hesitation, they should visit the nearest clinic or their diabetic consultant. So based upon their advice, they have to do some blood test to see whether there is any infection is there or not. If there is no infection, with simple measures and simple dressings, the wound can be easily healed. But if there is infection, then the doctor will put medication accordingly. If you follow the medication, the wounds will heal quickly.
Yes. Thank you, Doctor. I don't think we have any more questions. So I think that's it. So I would like to inform you that there is a camp going on at Ahalya Hospital this month for diabetes. So if you want to know more information about the camp, please go to, you can contact this number and this email ID. So I have posted the contact number and email ID in the chat. And also we have got a few requests for the PowerPoint presentation. So if any parents require the PowerPoint presentations, please contact the class teacher of your ward. We will make the PowerPoint available to you through the class teacher. So I think those are all the queries. Thank you very much, Doctor. So gratitude is the most exquisite form of courtesy. Let me now hand over the stage to our Vice Principal, Ms. Raufia, to extend the vote of thanks.
Assalamu alaikum. Good evening, everyone. At the outset, I extend my sincere thanks to Dr. Ahmed Hossain Rafi for educating and enlightening this wonderful session. We deeply appreciate your presence with us, sir. Thank you very much. I also thank our beloved principal, Mr. Saji Uman, for his effort and his encouragement to make this event a reality one. I also thank our CCA team and the IT department for this wonderful, successful session on diabetes and its management. But at last, I want to thank our parent community for the wonderful support. It's a great time and effort you provided with us. Thank you, everyone.
Once again, a big thanks to all of you. Thank you very much, Doctor. I think we can wrap up the session for today. A big thanks to all of you and have a good evening, everyone.